Hey everyone, it's Dr. Rick, and I'm going to talk about the PCR and rapid antigen tests for COVID-19. As I've heard some very confusing information that has been given to my patients as far as which one and how to interpret those things. The last patient said that her rapid was positive, her PCR was negative, potential for a false positive rapid. But then when she went back in, the same thing occurred. Rapid positive, PCR negative. And that's very unusual. She asked the pharmacist, well, why is that? Pharmacist said, you probably have Delta because Delta gives you a rapid positive, but Omicron gives you a negative PCR. That's false. That's misinformation, and it's confusing everybody. I'm going to try to make it easy to figure out how to use testing and how to stay safe. I'm going to use my example because I have a new grandson, Aiden, 2 going on 3 weeks old now. I don't want to transmit an infection to him, whether it's COVID or influenza or strep throat or anything. I really have to be careful. All my COVID patients in my COVID clinic are virtual, but I do work at another clinic. Normal patients without symptoms can also be exposed and contagious, which again, I'll talk about that in the pathophysiology of this virus, which is novel and very interesting. So without getting into too many details, which I sometimes have a tendency to do, I just want to make this very easy to translate to you guys. Right now we have Omicron, which is fast. It's so fast, everybody's getting sick and then getting better. Some of the sick people are going to the emergency room, going to the doctor's offices, and it's kind of like a front-loaded congestion to the hospital system versus the other way with Delta, where everybody that was sick is going straight to the ICU. That's the last holdout. But when the ICUs in the hospitals in America get clogged up, nobody can go into the hospital anymore. There's something called bypass. When the ICU is full, you cannot take any more patients, and the ER, emergency room, has to close down. Worst case scenario, if somebody from the ER walks in and they have to be transported to the ICU and it's full, they die. Surgeries, no, everything gets put on bypass. So the volume of people getting sick with Omicron is high, really high, because it's spreading fast. The data reports that most of the people going to the hospital are unvaccinated. I'm seeing in the clinic, vaccinated, boosted, unvaccinated, everybody's getting it. Young, old, everybody's getting it, but everybody's also getting better relatively quick. Some people, I just say, here's an option. If you don't want to join the COVID clinic, just keep an eye out on things. The other 50% that I have with comorbid conditions, I say no, don't take a chance. Just do the protocol that I have. Symptom control will get one of the two, ivermectin or fluvoxamine, or possibly colchicine, inhaled steroids, oral, depending on the patient. And there's other things down the line. That's how the majority of my patients come in. 50% will call up and I'll say, well, you're probably going to be okay. The other half that comes in early or contacts me early, I'll kind of waddle through their risk factors. I'll see how they've done before. If they're couch potatoes, no, they're getting everything. If they're healthy athletes, I might suggest them to just wait and not avail of my services. But it's very difficult to tell who's going to get sick. I have athletes that get sick. I had a very good cyclist, and this guy's got power in his legs. He is older. I didn't think he would have any problems, but he had to go to the hospital. And he resolved everything quickly, but there are no rules with this virus, and it attacks everybody. So you can take your chances and roll the dice, or you can have the insurance. If you are up for a vaccine, side effects with the vaccine, but minimal, repurposed medicine, quiet down and speed up the resolution or accelerate you getting over the infection. So I'll show you this. If you know the pathophysiology of how this occurs, then you know when to deploy the test. So let's just start with Day 0, assuming you don't have any symptoms, exposure to somebody that's positive for COVID. The other first day of symptoms. If you do have an infection, you can't tell who has it, and just assume the whole community is infected, which essentially the whole community is infected. Like any infection, it starts to ramp up. All you need is one inoculum, and it has to be a rather large inoculum, meaning that you have to have enough viral particles go from infected guy or gal to you in your nose or mouth. And that's where the virus usually will have a rally point. And when it starts and it embeds itself, it'll start to multiply. Your immune system will start to react. If you've had the vaccine, your immune system already knows the fake spike protein from the vaccine. The vaccine gives us fake presence of a spike protein, synthetic. So antibodies are made against this. But if the true infection comes, the antibodies that know the fake one can easily attack the real one. And that's why the infection goes away fast. Let me tell you, the speed at which Omicron hits is just, it swarms even the best immune systems, even the athletes. Think of it this way. If you have two bouncers at a nightclub front door, if you have two people that are tinier than the bouncers and they try to storm the door, they're not going to get through. I mean, one-on-one, two bouncers, two tiny people. If you have a sea of teenagers that wants to get into that nightclub, all they have to do is overwhelm the bouncers and they get through. So that's how COVID works. COVID has little spikes on it, and antibodies are produced by your white blood cells that have had a previous exposure. If those are the spike proteins, then the antibodies come and they bind on the spike proteins. If the antibodies bind on spike proteins, this thing cannot adhere to your cells. The organism itself can't connect to the cells in the nose or mouth, and you essentially have a dead virus. It can't replicate. But the problem, like swarming the bouncers, the problem is this thing just reproduces so fast that the immune system cannot keep up. The antibodies in the average human will try to keep up, but unfortunately, until it's ramped up, you will have the manifestation here of the symptoms of COVID infection. Fevers, chills, body aches, cough, headaches. If you look at the pathophysiology, by the third day with Omicron, it becomes symptomatic. So people that were exposed on day 0, they will probably start to have symptoms on day 3. And then they'll soon ramp up as the body is overwhelmed. But it'll hit a plateau and start diving down when the immune system catches up. If you're healthy, have low comorbid conditions, maybe had the vaccine, and maybe saw me for other things like fluvoxamine and ivermectin. Again, check out my videos on how those things work. Hopefully you'll understand it. They weren't too detailed, but that's how we try to squeeze or accelerate the time frame. Compressing the time frame of suffering has always been important with integrative medicine, whether it's compressing morbidity and living till you're 80, productive, and then dying quick, compared to living till you're 70 and dying slow, which is not cool. Andy Weil always taught me, and that's why I continue to teach and practice integrative medicine. This is nothing different. I want to compress this. And any doctor wants to do that, but sometimes the algorithms in Western medicine say, nah, don't do anything. It's not worth it, because if you look at the protocols and the studies, the population will do better if you don't do that, and we don't want to waste money. Well, I say, screw that. Not that I don't want to waste money, but if I apply population studies to a town, I think that's fair. To apply population studies to an individual, it's not fair. I'm not going to just throw everything and take a chance with side effects. I will do this in a smart, personalized way. But by the time everything peaks, as far as the headaches, the symptoms, fevers, chills, body aches, there will be a time when we decrease those symptoms. And if I can make them go away really fast, even better. If we make them go away slow, that's long hauler syndrome. And that's not cool. I have one patient that kind of long hauler, but we're tuning it up. I'm making sure she doesn't have any problems with her heart. But see, there's many different ways to skin this cat. And that's how guidelines are meant to be. They're only guidelines for us to figure out what do we deploy for that plan for the one person in the room, not the whole population. If we have an issue with spiking here and it lasts, I gotta make sure we're not missing something. Well, if you know this pathophysiology, it goes like this, and you don't have symptoms from day 0, but you suddenly have symptoms on day 3. If you have the symptoms and they're obvious, and you don't usually have headaches, body aches, cough, fever, stuffy nose this time of year, then the likelihood is it's infection. So if it is infection, again, you should follow the CDC's guidelines as far as masking, not spreading it to anybody else, and then call me or some other COVID clinic that will help you. Sometimes if it's even worse than that, chest pain, severe abdominal pain, you can't breathe, pulse ox goes below 90, it's time to go to the emergency room. The rapid test is the home test. It's called a lateral flow. So it's those little cartridges that you get at CVS or Walgreens, rapid test kits that have been approved by the FDA. I could not find specificity or sensitivity in the rapids as far as what they presented to the FDA. And there's also user error involved in that. If you have somebody that kind of moving around like a kid, a 2-year-old, and some of these you can do to 2-year-olds, if you're moving around and you can't get a good swab, that might not be enough viral particle to turn positive on the lateral flow test. So it's going to be naturally negative. You can see the downside problem if you do a bad job at swabbing. The best time to do a rapid test is when you're symptomatic. So if you have no symptoms and you're just going to a party, I'm going to see my grandson tomorrow, I will do a rapid test. I don't have any symptoms. Hopefully it'll be negative. If you're going to go somewhere, a large corporation, a large party, and you don't have any symptoms, I think it's fair to do a rapid test. In fact, you probably can't do a PCR if you're just going to a party, because it takes 2 days to 3 days for a PCR to come back. And you don't have to stick it all the way in. About 1 inch to 1.5 inches would be all you need. The swabs for self-testing are short, so you don't have to jab yourself. The swabs for hospital testing and clinic testing are long because we don't want to stand too close to our patients. So you can go like that, even though they're far away. And you don't have to stick the whole thing in there. You'll do a brain biopsy with the long ones. The rapid becomes accurate when you have enough of a viral load in your nose and mouth. And that's usually by the 5th day. So if you check out my video before with Omicron, if it is Omicron, you will probably have enough viral load in this rally point here or this rally point here for the virus to have a true swab. Your rapid will be positive in this window. And the window goes from about day 4.5 to day 8. They will offer you a rapid test. That's a screening test. Screening tests are kind of like rapid streps. So if you have a kid with a sore throat, we swab them for rapid. You get an answer within 15 minutes, and it's a rough answer, but if it's negative, we still swab for culture. Culture gets sent out, and usually it takes 3 days. If you're positive, go ahead and start antibiotics. And that's what we do with this. We'll give you, if you have a negative rapid test right here, I would usually say if it's negative, it would always be important to back that up with a PCR. Polymerase chain reaction is very sensitive, super sensitive. This is a gold standard. Rapids are easy. They're pretty cheap, 15 minutes, and you can buy them anywhere. You're supposed to get reimbursed, by the way. PCRs, I don't have to get into the details of the way this works and that works, but you have to have a big machine that amplifies the RNA to DNA change and increases the chances of truly finding a positive. It takes like 2 to 3 days. It's done the same way. You still have to swab either the throat or the nose, and you send it off to the lab. Usually it's a hospital or someplace like Quest. And they have these huge machines that read fluorescence. It's not a new technology. That is how this works. The PCR checks for the viral, meaning the DNA, RNA, and the rapid checks for the proteins. It's a rougher test. The rapid test is a rougher test. Could be that if you're way out here and you're getting better and you have no symptoms, you don't need to check anymore. The workplaces will mandate at least a rapid test. If you're way out here and you have symptoms and you're not sure, is it COVID? Is it a secondary bacterial infection? Is it influenza? And you'll have to get advice from your doctor. That in a nutshell is what we're talking about here. Because of the fact that these test kits are available in the pharmacy, a lot of patients are getting symptoms, cold, cough, fever, chills, headache, and they're swabbing themselves, but they're swabbing themselves right at the first day. Even though you're having symptoms on day 1, you might not have enough viral load to have a positive test until day 3 to 5. PCRs are usually only with doctor offices. There is one PCR that is sold at Walgreens, but you still have to mail it out, and it takes like 8 days to come back. And that's the one that's $125. There is one more test that you might take advantage of, and that would be antibody levels. Thus far, the government, the CDC, has stamped on their website, antibody levels cannot be trusted. You cannot use antibody levels to determine who has been exposed or who needs a booster. And I don't understand that, because we do it for everything else. We check you for antibody levels to mumps, measles, and rubella. Because if you don't have antibody levels to that, and you carry a baby for 9 months, and you get exposed, that kid ends up with cleft palate and a couple other things. So what happens? If the antibody levels are low, we give them the vaccine. We give them the vaccine if the antibody levels are low. So it's been used before. As physicians, the guidelines say, don't trust antibody levels. You can make your own determination, but I'm telling my patients, it's case-by-case basis, but consider this. Before you get your booster, before you get your second vaccine, before you get vaccinated, consider an antibody level. I think it's fair to do an IgG quantitative antibody level on SARS-CoV-19. As far as spike protein, maybe nucleocapsid, just to see what your antibody level is. If it's 000, you gotta get some protection, or you gotta shelter in place and stay as a hermit crab for the next year. If your antibody levels are greater than 150, because Quest checks antibody levels in a quantitative fashion, Health Labs doesn't, and I'm not sure if LabCorp does. What I've been offering to my patients is if that you're greater than 150, you're protected. We can come up with a plan as far as boosting or vaccines or sheltering in place, but I'm starting to offer patients checking every 3 to 6 months. According to data that has not been peer-reviewed, 300,000 healthcare workers were followed over 13 months, and the ones that had natural immunity, meaning they got infected, actually continued to have antibodies produced at the 13-month mark. That's spectacular. If you have a doctor and your relationship is good and you trust your doctor, this is the step-by-step approach to figuring out how to best serve you guys and how to kind of navigate through these muddy waters. And there's always going to be a different path for everybody, just by a nuanced change here and there. But the most important thing is you gotta try to stay super healthy, gotta try to eat right, gotta sleep well with exercise, eating, and calming practice and good sleep. That'll get you to longevity so you don't succumb to any of this crap, whether it's this or elevated cholesterols. Hopefully this gives you a couple of ideas on how to stay protected, how to deploy one versus another, or just to go throw your hands up and be a hermit. If you have any questions, please put them in the comment section down below. If you like this video, share it with other confused individuals or doctors. Try to stay safe. Consider subscribing to my Herbal 411 YouTube page. Otherwise, I'll see you at the next video.